Hi, my name is Ali Joseph. I'm a nursing student at the University of Toledo and I'll be doing a head-to-toe assessment.
Hi, I'm Rakesh Giri and I have a signed consent form and I consent Ali Joseph to do a head-to-toe assessment today.
So I would walk into the room, I would wash my hands, provide privacy. Hi, my name is Ali Joseph. I'll be your nurse for today. Can I have your name and date of birth, please?
Hi, my name is Rakesh Giri and my date of birth is 09/12/83.
Thank you very much. Do you know why we're here today?
For a head-to-toe assessment.
And is there any medical reason why we should not take the head-to-toe assessment?
No, I'm fine.
Okay, based on my initial assessment of Rakesh, he is a healthy male. His shoulders are down and back, showing that he's comfortable and relaxed. He is providing thrift eye contact, and he's smiling, showing that he's in a good mood. Now, do you know what time it is?
Around 5:30 in the
Can you
evening.
tell me your name?
Rakesh Giri
Where are we?
in the hospital.
And do you know who the governor of Ohio is?
It's divine.
Very good. So Rakesh is alert and aware ×4, and his speech and tone are proper and clear for this type of setting. Now I'm going to be taking your pulse. Normal pulse rate is 60 to 100 beats per minute. And if it is regular, I would take it for 30 seconds times it by 2. If it's irregular, I would take it for the full minute. Rakesh's pulse is regular and it is 80 beats per minute. Now I will be taking respirations. Now in a normal hospital setting, I would not tell the patient that I'm taking respirations because their breathing could be labored and they could get nervous. So I'm going to take Rakesh's breathing. Just please breathe in and out normally. Rakesh had 13 respirations in a minute. Now I'm going to be taking his blood pressure. Reasons I could not take blood pressures in this arm would probably be because of an IV or a mastectomy. I'm going to do the 40-80 rule. It is 40% and 80. This is a perfect cuff for him. Let me find rest, please. Let me find your pulse. Okay. Do you know your normal blood pressure rate?
Probably very normal, 80 to 120, I think.
120 over 80, okay. So we will be going 30 over his normal. It is 120 over 74, which is a normal finding. Now we will be checking Rakesh's head. His head is normal and cephalic. His face is round. His ears are symmetrical, and his can you raise your eyebrows, please? His eyebrows are symmetrical. His eyes are in line with his ears. And can you smile, please? And his smile is non-drooping. Now I am going to check Rakesh's eyes. Can you I'm going to check if his eyes are responsive. So can you look here, please? Look straight. Open your eyes bigger. His left eye is responsive, as is his right. Now I'm going to check the size of his eyes. His eye size are 4 on the left and 4 on the right. Now if you can find a point on the, his eyes are also round, and, which is a normal finding. Can you put your hand in the middle of your face, please? I'm going to check for an indirect light response on the eye that is not receiving light. His left eye is responsive to that, as is his right, which is a normal finding. Now, if you can look at the tip of my pen when it goes towards the tip of your nose, please. His eyes are constricting and converging, which in reference to accommodation, which is a normal finding. Now I'm going to go towards his arm. So can you give me your arm, please? Can I touch you?
Yeah, sure.
Okay. So I'm going to check for his arm temperature first, using the back of my hand. His arm is warm to the touch, and it is cooler at the fingertips, which is a normal finding. Now I'm going to palpate his arm, and if you can tell me if you feel any pain or tenderness as I'm going down the arm, particularly at the joints, please.
Sure.
Any pain?
No.
Any pain at all?
No, nothing.
Also, from what I assessed from Rakesh's arm, looking at the entire arm, his hair is evenly distributed throughout his arm. There are no lesions in his arm, and he has a beige skin tone. Now I'm going to move on to his chest to listen to chest sounds. When I put my stethoscope, I'm going to also auscultate, I'm going to listen to his chest, and when I put my stethoscope on your chest, if you can breathe normally, please.
Sure.
I'm going to start above the clavicle first. Breathe in and out, please, normally. Those are our normal chest sounds. And I heard no wheezing or crackling or bronchi. Could you sit up, please, as I listen to your chest sounds in the back, please? I will start at the apices. Come over here, please, so you can see. Come from the back. Breathe in and out normally, please. I also heard normal sounds, no crackling, no wheezing, and no bronchi as well. Now I'm going to move on to listening to his heart sounds. I'm going to be starting at the right second aortic intercostal space. Breathe in and out normally, please. I'm going to be moving to the left second intercostal space, the pulmonic space. Now I'm going to be on the third left intercostal space, known as Erb's Point. This is also where you would hear murmurs. Now I'm on the fifth left intercostal space, above the mitral valve. Also the fifth intercostal space above the tricuspid. Now, between the tricuspid and the mitral, you will hear S1 sounds, and between the aortic and pulmonic, you will hear S2 sounds. Now I'm going to be moving on to the abdomen. If you can lay down flat, please. If you could expose your abdomen, please. I am going to be auscultating. Originally, looking at Rakesh, his umbilicus is midline. Also, his abdominal regions are symmetrical. I'm going to be auscultating your abdominal region, your 4 regions, with 2 points in each region. Just breathe normally, please. 5 to 30 bowel sounds per minute is a normal finding. So we're going to be listening to those types of sounds now. If you could raise the camera, please. We are moving clockwise. Again, 5 to 30 bowel sounds per minute is normal, and Rakesh is within that range. Now I'm going to be moving to his leg. If you could show me your leg, please. You can cover this back up. Thank you very much. I am going to be taking his temperature first with my back hand. His leg is warm to the touch, going down to his toes. it becomes cooler, which is normal. Now I'm going to be palpating his leg. If you sense any type of tenderness or pain, particularly at the joints, please let me know.
Sure.
Did you feel any tenderness or pain?
No, I didn't.
Okay. At my assessment of his leg, he has even hair distribution. He does not have any lesions looking at the front and back. He has a brown skin tone and no edema is present. It is rebounding as you press down. So that's a 1 for edema. Now I'm going to be looking at skin breakdown along his leg to his foot and in between his toes. Looking at underneath his heel, in the back of his foot. I see no skin breakdown on his leg going down to his knee, tibula and fibula, and going down to his foot. I see no breakdown, which is a normal finding. Now I'm going to be looking at his pulse. I'm going to be trying to find his tibular pulse, and that would be behind the ankle. That would be a 2+ pulse elastic. Now I'm going to be looking at his posterior pedis pulse, which is in between his big toe and his middle toe. That is a 1+ elastic, and also I would be looking for any IVs. I would be looking for any follies, and I would position the patient for comfort. I would put the bed in the lowest position. I would have his items within reach, his call light within reach. I would also have, I'd make sure the side rails are up ×2, and I would wash my hands, I would exit the room, and I would document my findings.